Hello, everybody. My name is Lael Rabat, and I am the Programs Director at the Asian Pacific Community in Action. I'm about to be joined by Dr. Emma Vieira, Executive Director of Unlimited Potential, one of our partners in our oral health advocacy program. So, Emma, welcome.
Thank you.
Yeah, so I'm having a hard time seeing you right now. I'm not sure what's going on with your video camera, but I can hear you. So can you tell us a little bit more about yourself and your organization?
Sure. Thank you for having me here today. Unlimited Potential started back in 1985, and it was a very grassroots movement. Parents coming together saying, we want a better, brighter future for our children. At that time, the executive director of the founders and executive director, Jeannie Devine and Barbara Austin, uh, talked to the parents and said, well, if you want to have a better future for your children, you need to start with you. And making sure that we are breaking the cycle, and you as a family having a strong foundation to move your family in prosperity. And that's when the organization was founded. Today, we continue to have that strong foundation in education. Our mission actually is to ignite unity, pride, and dignity through education and advocacy. So every program that we have at Unlimited Potential has that education as the foundation for everything that we do. We are very fortunate to have now over 100 community health workers, very active individuals in the community. And we have multiple pillars that we focus our education. We have the training for community health workers, but in addition to that, we practice in the maternal and child area, where the community health workers are working with families and making sure that the families have a strong foundation, and it brings that unity to the family. We also work in nutrition and physical activity. We are part of we are one of the organizations, founders of Spaces of Opportunity, which is 19 acres of urban farming in South Phoenix. And through this year that has been an unprecedented year for everyone, we were very fortunate to be able to distribute over 60,000 pounds of fresh, locally grown produce due to the partnership that we have with Spaces of Opportunity. And the community health workers were amazing and instrumental in distributing those produce to families. And we went to senior centers, we went to schools, we went to community centers. So it's really been, among all the craziness, it has been a blessing to see the community health workers in action making a difference. So I'm extremely proud to be with Unlimited Potential.
And I love the work that you do. I love visiting with you and with the community health workers and handing out at spaces of opportunity. It definitely is a blessing. And it's really incredible to work with Unlimited Potential. And it's been awesome these last few years on the Oral Health Project.
Mm-hmm.
Um, can you tell us a little bit about your involvement with the Oral Health Project and what you're, currently doing and just some information about that?
Sure. In oral health, I do believe that oral health is one of the areas that many times is neglected in health. So therefore, we intentionally we focus in bringing the oral health and the importance to oral health to every education and every interaction that we have. And it could be as simple as providing toothbrush and toothpaste for brushing their teeth, but also just talking about, right now, as I mentioned, one of the programs that we have is the Health Start, which is a prenatal and postnatal care. And in that curriculum, that education and that interaction with the families, oral health is an essential component of that education. Because if we see that the mother during pregnancy has good oral health, that will result in the children having less cavities. So and it will help also in the nutrition as a whole of the child, and again, the health of the family. So we bring that component, as well as we have done in conjunction with Asian Pacific, we and other organizations, we have done um, the mic, the storytelling of oral health, and just bringing awareness of oral health issues into just the day to day and normalizing the conversation. One of the experience that I had is one particular individual I used to work with. She didn't have any um, teeth. She had lost all her teeth, and it took her forever to be able to afford dentures. But the difference, the confidence that that person went from not having any to having her dentures and her change in her life, it was a it was like looking at a complete different person. So I do want to, I, as an organization, as the executive director of Unlimited Potential, I want to make sure that that is one aspect that we all can have an impact in, that self image, self respect.
Yeah, and the way that it affects the body as well, the malnutrition from not being able to eat food that you have to chew a lot, and the it's really a struggle for people to access that care. Did you know how they were able to finally access it? Did they get insurance? Did they go to a dental school? How were they finally able to get dentures?
We all did a collection, and
Wow.
it took some it took several years actually, but because it's not uh, oral health is oral health by itself of flossing and brushing is fairly affordable, but the treatment is very expensive, as in so getting dentures was
Mhm.
very a long process for her, but at the end it worked and her whole life changed.
That's incredible. I'm glad to hear that. Yeah, and it's a struggle for a lot of people to even be able to access preventive services, getting your cleaning every few months because brushing and flossing is a fantastic way to take care of your teeth, but a lot of times we also need that additional help of being able to go to get our regular and routine cleanings. And I think that there's a lot of thought in society that losing your teeth is a part of life, but it's not. Oral disease is completely preventable. Losing teeth should not be a part of life. And if we were able to get everybody access to preventive services, we would be able to eradicate oral disease like we have many other diseases that are contagious.
Definitely.
And so it's really it's remarkable how your community was able to come together and to support this person, and I really hope to see in the future that as wonderful as it is that people came together to support them, I hope to see more people get access to care, you know, and prevention before it escalates to that point. And so thank you so much for sharing that story with us. And we've also this whole year we've been focusing on talking about oral health and pregnancy, right?
Mhm.
And the correlative relationship between issues with your mouth and issues with pregnancy and all of those things. And so, can you talk a little bit about that, please?
Sure. As I mentioned before, when the individual, when the mother during her pregnancy stage has a good oral health, that actually, um, and the end result of that is that the child will have less cavities. And in reality, you can never start too early to accustom the child to go to the dentist.
Mm-hmm.
And as early as you can, 6 months, taking and just being familiar with the gums. Is everything looking well? And
Mm-hmm.
is everything coming? And the other thing that it is extremely important is the sealants. Putting sealants in at a young age really prevents cavity. It improves the oral health of that child.
Mm-hmm.
And remember, I can tell you, I have three daughters, and all three of them they had sealants in their baby teeth as well as the adults. And they I have been taking them just for checkups since they were
Mm-hmm.
6 months old. They have great great oral health right now.
That's wonderful. Yeah, and I think especially right now during the COVID crisis, a lot of people aren't accessing the care that they need, and so that's a huge concern.
Yeah.
From a public health perspective, to know that a lot of families just aren't going to get their preventive care right now because of the
Mhm.
crisis and the difficulty. And so, I've been paying attention to see what people are doing and what we're going to do to address the issue now that the COVID vaccine is out and we're going to start going back to the way that things were. So we had a question come through, and so the question is how, other than the cost, because we know that cost is the biggest issue, but how can oral health services become more accessible?
Well, community health centers, not all, but some of the community health centers, at least here in Maricopa County, do provide some oral health services,
Hmm.
as well as their oral health or dental clinics. But we don't. There is not enough. We do have the schools. And as the question is saying, the cost is prohibited for even when it is at reduced fee.
Hmm.
It's really in my mind, it's really policy, changing and advocating for policy change that will make that difference. Because
Hmm.
yes, oral health should be available to everyone. And right now, no, when we look at access to care, it is difficult to find a medical, having a primary care provider and developing that medical home is by no, it is difficult. But
Hmm.
to have a oral health, a dental home, that is an even harder process. So and that is something that with advocacy, that is something with the community coming together, organizing themselves, and
Hmm.
then moving that to a policy change.
Yeah, definitely. And, we hear a lot of things about how transportation to get to the provider's office is a struggle. The hours that the providers are available is a struggle. not everybody is able to get on access, so that's a huge issue. Even for the children that qualify for Medicaid dental coverage, it's difficult for the parents to be able to take off work to get them to those appointments if they can find a dentist that is taking, new patients at the time. And so, yes, definitely, policy is the way to go, and it's not going to be one simple policy solution as much as it's going to be multiple people working on multiple fronts to change um, a variety of policies to get us to a point to where there is oral health access for everybody. So, you know,
Mhm.
let's see here. Yeah, so it doesn't look like we really have any more questions from the audience. Is there anything else that you want to share with us?
The other point is that when we look at this year that we have um, experienced, that we have lived, um, we have seen the disparities coming to light, and disparities in many issues. We have seen the health, the social, um, many many different diversities that come up to light. One thing that we can do is we can united we can solve many of those issues. And as you mentioned, with just uh, talking about the issues, recognizing these are serious problems, and then how can we as a group make that difference. I'm hoping that this new year brings that opportunity for all of us to be a little bit more conscious in how we can make a difference from where we are.
Definitely. We're so much more powerful when we come together. And I so appreciate you taking the time to share about your organization and about your work with us. And, we'll continue these conversations into this coming year. And so I'm hoping to be joined by even more people. And if you want to come back, you're always welcome as well. So thank you for taking that time to do this. I really appreciate you.
Thank you. My pleasure.